Hi, my name is Manoj Krishna. I'm a spine surgeon. Patients who have post-discectomy syndrome represent a particular challenge in spinal surgery. Often they suffer for many years. Here, Stevens had a single level degenerative disc at L5S1 and a discectomy done at that level. Um, on the cross section, you can see where the bone has been removed. Uh, Often patients like this suffer for many years before they get help. Stephen had a posterior lumbar interbody fusion at L5S1. The principle of surgery is to remove the pain generator, which is the disc and the facet joints, free up the nerves, and put something in the disc space that restores load bearing across the disc. We also put a small spacer above the disc to prevent the next level from degenerating quickly. Here's Stephen telling a story. Morning, Stephen.
Morning, Mr. Krishna.
So, Stephen, you're 42.
That's correct, yes.
And your back problem started when you were 28, 14 years ago.
Yes,
Okay,
1999.
Tell me a story about how it started and what's happened since.
Well, to go back then, originally, I remember operating some overhead line switchgear. I remember an initial sort of pain, but nothing significant. And then within the next couple of days, I couldn't get in and out of bed, I couldn't get dressed. It flared up significantly, and obviously you go to doctors, you try and find out what's wrong, but in the first instance you just think, oh, I've hurt my back, I've pulled a muscle, and eventually as things got worse and you go further down the line of seeking help, originally I was told it was a degenerate disease of the spine.
Yeah.
I had to leave work, and ultimately I was told by the time I was 40 I'd be in a wheelchair.
And then this continued, and 4 years ago you had a discectomy operation?
That's true. Yeah, a discectomy and a laminectomy.
Yeah. And with that you were better for a few months?
Absolutely, yeah. Initially the relief from the pain was almost instantaneous. The day after the operation, I was up and about and walking. It was, I do remember feeling quite, I think ecstatic might be the word.
But it didn't last for long?
Sadly not. No, 6 months
Yeah.
at the most, and I was literally back to square one again.
And by the time I saw you, which is about a year ago now, you were in a pretty bad way.
Yes, that would be fair to say, yes. I was certainly not myself.
I think you were on 25 tablets a day, including morphine.
Yeah, tramadol, morphine, what else? Pregabalin, oxycodone, citalopram, you name it. I think I've variously been on it one way or another.
And you say it affected your personality and...
Yes, yeah, it did.
all those tablets.
It was a strange affair. A lot of it's kind of lost in the clouds of time now. But on the one hand, you sort of dosed up and popped up. The sort of euphoric feelings that the morphine could give. I remember. I think you've probably heard the song "Golden Brown" by the Stranglers. And that's a song about heroin. And I can liken it to everything had this sort of sepia tinge to it, and the morphine had a very nice effect, if I dare say nice.
Right.
Yeah, I mean, I was away with the fairies, I think, for a considerable period of time.
Yeah, I operated on you a year ago. You had an L5S1 posterior lumbar interbody fusion. Yep. And tell me about that year, because it's been a tough year coming off all the medication.
Yeah, that really did surprise me. In the first instance, after the first operation, morphine, tramadol, the withdrawals, very few withdrawals. I found it relatively easy. This time round, and the only one I can really put the difference on would be the oxycodone or OxyContin. And it was that, well, to be fair, it shocked me. I really didn't expect that sort of trouble or length of time trying to come off a prescription tablet. It did.
How long did it take you? 6 months, I think?
Yes, maybe a little longer.
And you say you also had some problems with your teeth, just from grinding them.
Because obviously I'd been quite ill for a period of time, so I'd not been to the dentist for over a year. By the time I got back to see the dentist, they'd noticed that 4 molars on the right side, 3 molars on the left were fractured, cracked, and they'd seen some considerable wear in terms of what was obvious signs of grating of the teeth. I was aware that I was grating my teeth because my partner would wake up in the middle of the night and nudge me and trying to stop me to do it. But yeah, I'd been clenching my jaw so much and grating my teeth so much during the withdrawal period. I'd broken 7 teeth.
And how long did you notice, after surgery, did it take you to notice the pain was better?
Almost straight away. Obviously, there's the amount of medication that you're on that does numb that. There was obviously the pain associated with the actual event, the operation itself. But in terms of the sort of the nerve pain, the twitching in the legs, the cramps, and all that pain associated with the problem was virtually removed almost straight away.
Okay. And now you're a year from surgery. How's it going now?
Oh, it's brilliant. It's brilliant, yeah. Now I reckon I'm over the withdrawals and the problems with the tablets. My partner's just recently moved in. She's an 8-year-old boy. Sorry, that's not my partner. She has an 8-year-old boy, I should say.
Yeah.
And yeah, it's great. You know, playing football, messing about.
No painkillers?
No painkillers.
And no pain?
And no pain.
Wow.
No,
For the first time in what?
14 years.
14 years.
Yeah.
It's a new life.
It is a new life, yeah. Which is queer. It's almost like a new beginning. I'm having to reevaluate everything again. But yeah, it's good.
And you've lost a chunk of memory because you can't really remember bits of your life during that period.
True, yeah. There are parts there where, yeah, it is almost like memory loss. I've got images, I've got
the details.
Vague memory. The details have gone. I do actually find as well at the moment my memory is a bit poor. It's shocking, really. It's winding the girlfriend up a little bit because she'll tell me something and it's literally in one ear and out the other.
Well, we can't blame everything on tablets.
This is true.
Okay, well, thank you very much, Steve. Thank you.
This is true.